So in my practice here in Miami, I do a lot of arm lifts. And one thing patients say to me a lot is that their arms just don't really fit the rest of their body, especially women. And what they'll express to me is they've been able to lose weight, but just the arms stay the same. And now they're in a situation where they just look disproportionate. So lipedema is a very poorly understood condition where the patient gains a disproportionate amount of weight, usually in their legs, but it can also happen in the arms. Typically, it happens to women around the time of puberty, and in some studies, it can be up to 11% of folks. Because this condition is poorly understood, many patients will be told it's just because they've gained weight, and they'll struggle with diet and exercise in all the usual ways, but these legs or arms are very resistant to the usual methods. Furthermore, they may get pain in the arms or legs and are definitely much more susceptible to bruising. So the good news is there is a treatment for this. It's usually surgery, however. We'll typically use a combination of liposuction in just mild cases, but more often we'll do liposuction and either an arm lift or a thigh lift, depending on where the problem is. With these cases, we have to do pretty aggressive liposuction to treat the area. And when we're done with the liposuction, usually because we've removed so much, there's going to be loose skin left behind. So the solution is going to be to do a lift. My lovely patient we treated this week with her arms, she had been able to lose weight everywhere else in her body, had been on a whole new diet and exercise fitness regime, but the arms just stayed the same. And it was awesome when her bandages came off. It was such a huge difference. And now finally her arms fit the rest of the body. So if this sounds familiar to you, you may actually have lipedema. It is much more common than most people know about, but thankfully there is a treatment.